7th November. The focus is on prevention, awareness, and early detection. So in India, cancer care is given by the regional cancer centers, usually 1 or 2 regional cancer centers in a state, tertiary cancer care centers, state cancer institutes, oncology wing in government medical colleges and hospitals, and by private hospitals and private medical college hospitals like the ones I work for. So as you're well aware that cancer is an expensive disease to treat. For people who cannot afford, it's going to be tough financially. So there are certain schemes by the government to help fund people for cancer treatment for those who are below poverty line. The financial assistance is given to the tune of 2 lakhs per patient for those taking treatment at regional cancer centers, but certain documents are required for processing. So what we should understand primarily is that cancer is a genetic disease. So sometimes it is also an inherited disease. We'll see more in detail about what I mean by saying it's a genetic disease and what I mean by saying it's an inherited disease. So to understand cancer, we should understand the structure of our cells. So the cells has 2 parts, the cytoplasm and the nucleus. The nucleus has the genetic material in the form of chromosomes. The chromosomes are made up of DNA, and the DNA is consisting of 2 strands of DNA linked by nucleotide base pairs. A segment of this DNA is called the gene. This is the basic understanding to understand what causes cancer. So this is a magnified view of 2 DNA strands and nucleotide base pairs. Any change in these nucleotide base pairs is called a mutation. So gene is a segment of this DNA. It consists of nucleotide base pairs. Any change in this nucleotide base pairs, adenine, thymine, guanine, cytosine, if any change is there in these base pairs, it leads to the formation of a mutation. So on a lighter note, I want to ask you, which chromosome has the least number of genes? Is it the X chromosome, which is seen in female, or the Y chromosome, which is seen in male? So female has 2 X chromosomes, male has 1 X and 1 Y chromosome. So the answer is going to be shocking for the male superiority people in the group. So it's actually the Y chromosome in our cells that has the least number of genes. Coming back to our topic, so mutations can be of 2 types, the somatic mutation and the inherited mutation. Somatic mutation occurs from spontaneous errors in the DNA replication. We'll see that in the next slides, and also can cause by environmental changes. Inherited mutations are transmitted from parent to child. So this picture shows it all. The human body is made of billions of cells. Now the cells are of 2 types. The somatic cells, which are found throughout the body and the organs like skin cells, the cells of the liver, and so on. And the germ cells, which are seen in the egg and sperm. If the mutation occurs in the somatic cells, like for example the cell in the breast, then this mutation is called a somatic mutation. It is not transmitted from parent to child. Whereas if this mutation is found in the germ cells, if it may be found in the somatic cells, it may also be found in the germ cells. If it is found in the germ cells, then what happens? This mutation can be transmitted from parent to child. This is an inherited mutation. So once this mutation occurs, what does it do? Several times mutation does not cause much changes, it just remains. But in some instances, it can lead to certain changes in the cell functioning. It can activate oncogenes which promote cancer cell growth. It can inactivate tumor suppressor genes which suppress cancer growth, or it can result in damage to the DNA mismatch repair genes, which may lead to cancer again. We'll see this more in detail. So cancer, these mutations are caused by either in heredity coming from parent to child, by ultraviolet radiation from the sun, chemicals which are present in the environment, viruses which we are infected by, all important cause of smoking, tobacco, and DNA repair abnormalities when the cell is dividing. So age also an important factor in causing cancer. Normally the cells in our body are constantly dividing, and while dividing the DNA also replicates itself. From one cell it needs to have DNA for two cells. This is done by the process of DNA replication. When this DNA replicates, there are certain errors which occur. It can 1,20,000 errors can occur every time a cell divides. However, these errors are identified by a specific mechanism called the DNA repair mechanism, and these errors are repaired. But as we grow older, as the cells divide and divide and divide, these changes keep accumulating. Some errors which are not repaired, these keep accumulating. So as we grow older, more number of errors in the DNA accumulate, and this leads to higher risk of cancer as we grow older. So cancer is an expensive disease to treat when it comes in advanced stages. Many of you may be aware of that. So the key to fighting cancer is to prevent it or to detect it early. To understand how to do this, we should know what are the risk factors for cancer. So there are several risk factors for cancer. By risk factors, what I mean is, not all risk factors cause 100% cancer in everybody. For example, if we take smoking, doesn't mean that all smokers will get cancer. It means that smoking increases the risk of cancer. Doesn't mean that everyone who smokes will get cancer. But person who doesn't smoke and person who smokes, if you compare, the risk of cancer is more in the smokers. That's what we have to take home. The same corollary also is true. It doesn't mean that those who don't smoke will not get cancer. But the chance of getting a lung cancer by not smoking is lesser when compared to smokers. So there is no absolute 0 or absolute 100 as far as risk factors are concerned. So be aware of the risk factors, take all precautions to prevent these risk factors, and go ahead. So alcohol is a risk factor, certain cancer causing substances in the environment, chemicals, chronic inflammation like in burns, patients who have burns are at higher risk of skin cancer. Diet with alcohol and charred red meat is a higher risk for cancer. Oral contraceptive pills, it causes a 7% increase in risk of breast cancer. The risk reduces 10 years after stopping oral contraceptive pills. It also increases the risk of cervical cancer. The advantages also are there that apart from being a contraceptive, it reduces the risk of uterine cancer or endometrial cancer by 30%. It reduces the risk of ovarian cancer and reduces the risk of colorectal cancer. But definite increase in risk of breast and cervical cancer. So be cautious when you're taking oral contraceptive pills. And postmenopausal hormone therapy. There are two types of postmenopausal hormone therapy. One is estrogen alone, another is progestin plus estrogen. Taking a combined pill increases the risk of breast cancer. It also has other side effects like vaginal bleeding, urinary incontinence, dementia, stroke, blood clots, and heart attack. However, the advantage is it reduces the risk of fractures. The reproductive cycle in a woman is very important. Early age at first pregnancy, having more pregnancies, longer duration of breastfeeding, all reduces the risk of breast cancer. Women with full-term pregnancy, have delivered a live child without any problem. They also have a reduced risk of uterine and ovarian cancer. Many of you may have a question, doctor. People now, because of lot of people with infertility, lot of hormones are given for these women in order to help them bear children. Whether this causes an increased risk of cancer. As of date, the available evidence, it does not point to an increased risk of breast, ovarian or uterine cancer in women taking fertility treatment. Coincidentally, it may happen that a woman who has taken hormones may have breast cancer, may have ovarian cancer. But cumulative available evidence does not point to an increased incidence compared to the general population. Immunosuppression due to medicines or HIV infection. Certain infections like Epstein-Barr virus will cause nasopharyngeal cancer, lymphoma. Hepatitis B infection can cause liver cancer, even hepatitis C virus. HIV can cause several cancers like cervical cancer, anal cancer, Kaposi sarcoma. Human papillomavirus, I'll come into more detail about that. It's a very important cancer-causing virus, which is preventable, not totally, to a great extent by vaccination. Helicobacter pylori infection in the stomach can cause stomach cancer. This Helicobacter pylori also, if we have ulcer disease or gastritis which shows H. pylori, if we take H. pylori eradication treatment, there is a chance that the gastritis will be cured. They may reduce the risk of stomach cancer. Obesity increases the risk of many cancers like endometrial cancer or uterine cancer, pancreatic cancer, esophageal cancer. Radiation exposure, like radiation exposure for CT scans, for X-rays, radiation treatment. Of course, radiation treatment is unavoidable in many instances, but childhood radiation exposure may increase the risk of cancer. Ultraviolet radiation from the sun, both UV, A, B, C, all this increases the risk of skin cancer. A very important preventable cause of cancer is tobacco. Do not chew tobacco, do not smoke tobacco, do not stay with people who smoke, because second-hand smoke also increases the risk of cancer. So how to prevent cancer? So prevention, what we can do in our hands, what is within our control is avoiding risk factors. We cannot stay away from pollution. We cannot consume a chemical-free diet. We cannot consume chemical-free water because the environment is already polluted. But there are certain things within our control which we can do to reduce the risk of us getting a cancer. We can avoid smoking and alcohol consumption. We can take vaccine against human papillomavirus and hepatitis B virus. We can avoid unnecessary radiation exposure like scans. Avoid excess sun exposure, especially during the time after 11 to 3 or 4 o'clock. If at all we are somewhat unavoidable, we can use the sun protection cream when you are going outside. Avoid charred red meat. Reduce weight and physical activity. This is perfectly within our control. We have to reduce our weight to reach ideal body weight, and we have to engage in physical activity around 30 minutes every day of physical activity. And before starting any hormone treatment, we should consult our doctor, see the risks and benefits. If the benefits are more than the risks, yes, you can go ahead. But if the risks are more, then definitely we should avoid taking hormone medication. Breastfeeding should be encouraged because longer duration of breastfeeding has shown that reduces the incidence of breast cancer. Breast cancer is the most common cancer among women in India and throughout the world. And education and literacy of women is of prime importance. It has shown that with education and literacy of women, the incidence of cancer reduces because women are aware about the risks and they protect themselves. And the men folk on whom the women are dependent should take them for early detection strategies like screening, which I'll talk to you in a short while. So it may be surprising to many of the women in the audience that 6 hours of household work, like household work or walks or gardening, reduces the risk of breast cancer by 13%. At least 2.5 hours reduces the risk of breast cancer as well. So household work is not a taboo. It reduces the risk of breast cancer and it gives you savings as well. So early detection of cancer, medical terminology for early detection is called screening. So there are certain cancers by which early detection is of benefit. For only those cancers, I'm going to tell you how to do early detection. For certain cancers, early detection is not possible. For example, ovarian cancer, early detection is not shown to be of any benefit. It is not possible to pick it up early. So colorectal cancer. Colorectal means the large intestine cancer. So the large intestine cancer can be detected early by doing a fecal test, this test of the motion, which is done once in 1 or 2 years to detect any blood is there in the motion or not. It is done by fecal immunochemical test or fecal occult blood test. Sigmoidoscopy, a tube is passed through the anus into the large intestine. It's done once in 5 to 10 years. The difference between sigmoidoscopy and colonoscopy is sigmoidoscopy images only the terminal portion of the large intestine, the last portion of the large intestine. Colonoscopy visualizes the entire large intestine. So sigmoidoscopy should be done once in 5 years. Colonoscopy should be done once in 10 years. Most of the cancers occur in the terminal portion of large intestine. That's why sigmoidoscopy is recommended. Colonoscopy is a more difficult procedure. Risk of complication is also slightly more, but it is a more thorough procedure. Virtual colonoscopy is a technique by which, by you doing a CT scan, we can see the entire colon, but small lesions may be missed and it's impossible to biopsy because it's only a CT scan. So the screening is done from the age of 50 till the age of 75. Breast cancer is the screening is very much possible in our country. Colorectal cancer, many people may have apprehension of doing a colonoscopy or sigmoidoscopy by passing a tube through the anus. Many people may find it difficult to accept and digest and go through the procedure. It's an uncomfortable procedure. But mammogram, definitely women can undergo the mammogram. Age of 50 years and older women should undergo a mammogram once in a year or once in 2 years. Select women in the age group of 40 to 49, after consultation with the oncologist, they can go for a mammogram. So nowadays mammogram is combined with the ultrasound at the same instance to correlate the pickup. So cervical cancer is also a very important cancer, more common in the rural India. It is becoming less common in urban India. So Pap smear, you must all heard of a Pap smear. It is done once in 3 years, the age of 21 to 29. Majority of cervical cancers are caused by human papilloma virus infection. So and majority of people will have, who are sexually active, will have the HPV DNA infection during their lifetime. Majority of them will have, but because of the robust immunity of the body, majority of people will clear the infection. But in some people, the infection persists and leads to cancer. So a Pap test is combined with a HPV DNA test once in 3 years for women aged between 30 to 65. Up to 30 years, it's only Pap test. 30 to 65 years, it is a Pap plus DNA test. Prostate cancer, there is no role for routine screening. People who want to be screened for prostate cancer, they have to discuss with the oncologist and see what are the risks and benefits and then decide on screening. Because prostate cancer is a disease of aging. Many people after a particular age, maybe 60 or 70, they have prostate cancer, but not all cancers are significant. It's a slow growing cancer in many of the people. So there's no conclusive evidence that if you pick it up early, the lifespan is going to be changed by screening. So that's why the recommendation is that there's no role for routine screening. The risks and benefits should be discussed, and for those who really want to have screening because they feel they have the risk factors, then it is done. Otherwise, it's not done. Lung cancer is a risk-based screening. Heavy smokers, the age of 55 to 80 years, every year they should have a low-dose CT scan, not for general population, only for heavy smokers. So genetic testing, this is a recent advance in the past 10 years which has come up in cancer. There are two types of genetic testing. One is check for inherited mutations. So people who have cancer in the family, they want to check whether they have inherited the mutation from the parents or then whether they have a higher risk because of the mutation. That is called genetic testing for inherited mutation, like breast cancer, BRCA1, BRCA2 or P53 mutation. The next type of mutation we check for is for somatic mutation. For example, a patient with ovarian cancer, she wants to know whether a particular therapy, targeted therapy, will be useful for her. So certain mutations, if they are present in the tumor tissue, then the tumor will respond to that particular medicine. If it is not there, it will not respond. So this is called somatic mutation testing. So inherited mutation testing and somatic mutation testing. Inherited mutation is to see whether the risk is there because of inherited mutation which has come from the parent. Somatic mutation is done to check whether particular person will respond to the treatment. So all important topic nowadays is cancer immunity. So immunity is very important in fighting diseases. Recently, it has been found that it's very important in fighting cancer also. As I told you, we have a robust cancer fighting mechanism. Cancerous cells constantly develop in the body. There are mechanisms to control these cancer cells and kill them in the early stage. This is done by cancer immune cells. So once a cancer cell develops, it expresses certain antigens which are not normal antigens. These are picked up by the antigen presenting cells. These antigen presenting cells present these antigens to the T cells. The T cells detect these antigens are abnormal. They go into the tumor and kill the cancer. This is what should happen normally. But when due to certain processes, if the immune system is overwhelmed, then what happens? Full-blown cancer develops. So immunotherapy. So how do we know that the immune system plays an important role in controlling cancer? How does immunotherapy help? How we use the immune system to treat cancer? That is immunotherapy. There are three types. One is non-specific immune stimulation, generalized immune stimulation, adaptive T cell therapy. This is an area of new interest, and immune checkpoint inhibitors, which has already become standard of care in many cancers. So non-specific immune stimulation, an example is BCG therapy for patients who have bladder cancer, which are early stage bladder cancer, non-muscle invasive. What happens is after the TURBT, that is, we put a tube into the bladder and scoop out the tumor by TURBT. It's called TURBT. The tumor is scraped off from the bladder. To prevent its recurrence, we instill BCG into the bladder, urinary bladder, and this reduces the risk of recurrence. This is a non-specific immunity method, immunotherapy method. Another is TIL therapy, tumor infiltrating lymphocyte therapy. So what happens when we do a biopsy for a particular cancer? We take the tissue, and in the tissue there will be a lot of immune cells called lymphocytes. These lymphocytes are put in the lab and they are expanded to millions or billions of lymphocytes. And then they are re-infused into the patient, and this will go into the tumor and kill the cancer cells. This is called TIL therapy. Some of you must have heard about this, the checkpoint inhibitors. This has become very, I wouldn't say common, has become an important tool in fighting advanced cancers. In many cases, advanced cancers. So the cancer cell is recognized, has with certain antigens on the surface. This is recognized by the T cell, the immune cell which fights the cancer. What happens once this antigen is detected by the T cell is supposed to kill the cancer cell. So the cancer cell is very intelligent. It expresses certain special proteins. In this case, in this picture, you can see PDL1. This PDL1 binds with the T cell receptor called PD1. And what it does, it escapes the immunity. This is an escape of immunity by the cancer cell by its tricky mechanisms. So there are medicines called ipilimumab, pembrolizumab. These medicines, what they do, they block this PDL1, PD1 interaction and disable the cancer cell from tricking the T cell. And the T cell kills the cancer cell. This is called checkpoint inhibitors. A recent advance in the fight of leukemia and lymphoma is the CAR T cell therapy. It's called a living drug. It's a living drug. What happens is the blood is removed from the patient. The T cells, the immune cells which fight cancer, are taken. Chimeric antigen receptor gene, it's called CAR, chimeric antigen receptor gene, is put into the T cell DNA, and the T cell starts expressing these receptors for the chimeric antigen receptor, CAR receptors it expresses. Then what happens? This T cell is put back into the patient and it destroys the cancer cells. This is cutting edge therapy in certain leukemias and lymphomas, but it's very expensive. And monoclonal antibodies. So antibodies can be used for immunotherapy. It can be used for targeted therapy. So for immunotherapy, how is it used? These antibodies will bind to certain antigens on the cancer cell and it will be killed by the immune system. Or it can bring the T cell together with the cancer cell and make it kill the cancer system. So this is all targeted or immune therapy. It doesn't act, it predominantly acts on the cancer. I'm not saying it doesn't have side effects, but it predominantly acts on the cancer cell because it's a immune mediated mechanism. So targeted therapy can help the immune system kill the cancer, that is by immunotherapy. It can prevent the cancer cells from growing, like it can act on the EGFR receptor. Many of you may have received the Herceptin. It blocks the HER2 receptor, it prevents the cell from growing. And an important mechanism of tumor growth. See, for us to grow, we need blood supply. The same thing for cancer. For the cancer to grow, it needs blood supply. So there are certain antibodies like bevacizumab, which will block the blood supply of the cancer, and it will lead to regression of the tumor. It will hormone therapy. It will starve the cancer cells of hormones which is required to multiply, and they also cause cancer cell death. These are the ways in which targeted therapies work. So I want to send a take-home message is this slide. The take-home message is this slide of the entire talk. And the next two slides are the take-home message. Vaccine. We all know because of this corona epidemic, we have learned that vaccination is the best method to prevent corona. Similarly, there are two cancers by which vaccine can reduce the risk of getting the cancer. One is human papillomavirus vaccine. Human papillomavirus vaccine, there are two types of vaccines, HPV4 and HPV2. The third type, HPV9, is not yet available in India. It's available in US. There are several types of human papillomavirus. Two main cancer-causing types are 16 and 18. By taking this vaccine, we can avoid infection of these two human papillomavirus. That way, cervical cancer risk can be reduced. Actually, WHO has taken up the task of eradicating cervical cancer by vaccination and screening. So it's going to be announced in the next week or so. Just like polio virus was eradicated, the WHO took steps to do that. Similarly, WHO is taking steps to eradicate cervical cancer from the face of the earth. The best way to do it is by screening and by vaccination. Another is the hepatitis B vaccine. Hepatitis B is very common in Asia. So it has become part of the universal vaccination schedule in India. All children are vaccinated against hepatitis B. So two important vaccines you should remember: human papillomavirus for cervical cancer, hepatitis B vaccine for liver cancer. So the next take-home message is: do not use tobacco, do not support the use of tobacco, and whether it is smoking, whether it is chewing, or whether it is passive smoking. Someone in the house is smoking. All these three things can reduce the risk of cancer to a great extent. With this, I conclude my talk. I hope this talk was useful to all of you, or at least some of you. I'm just going to open the discussion, open the forum for discussions. I'll unmute the participants. Thank you.
Hello, Doctor. This is Raju. Thanks for the great session and definitely increase the awareness of the about cancer and all. So just a quick question here. So there are so many different cancers and different things can come. What is the general advice for a regular healthy person? Because you suggested so many here and there to just to be sure, right? But is it like something we look at some symptoms and then go for the test, or or any some kind of a cheat sheet to look at through the age groups?
That's a good question. So there are two things, right? One is symptom and then going to for a check. That is to diagnose. So there are two aspects in cancer. One is diagnosis, another is screening. When a patient has a problem, then going to the doctor to find out what is the cause of problem is diagnosis. When the patient doesn't have any problem, just to go for a regular checkup, find out if there is an early sign of cancer is called screening. So screening is done for certain cancers like colorectal cancer, breast cancer, lung cancer, cervical cancer, and in some instances prostate cancer. Patient will be absolutely fine. There will be no problem. A particular cutoff age comes 50 years of age. They will go once in 2 years for a mammogram. That is screening. By this, certain cancers can be found early. But once the patient has symptoms, then going for a checkup, that is for diagnosis. It may be the cancer is early, but many of the time the cancer is more advanced stages.
Hello, doctor. Thank
Hello.
you. Did you hear us?
Yes, I can hear you. Go ahead.
Yeah. So in our family, there has been a recent cases of a lot of cancers, including my father-in-law's, his sisters and brothers, and also my husband had a recent tumor. What I was interested to know is about the genetic testing that you mentioned. Is that something is available already here in India, or if we, at what age would you recommend for children, or somebody from that family to get this tested?
Good question. So genetic testing is available in India. It is available in Bangalore also. It depends on what are the cancers which your family has. Usually these family cancers occur in form of syndromes. Like it's like a breast and ovarian cancer syndrome. So if we know what are the cancers which are occurring in the family, then we can find out what is the syndrome and look for a particular gene. If we have a syndrome. If we don't have a syndrome, then we have to have a genetic counseling and check for a panel of genes.
Okay, sounds good. Thanks, good. And also for these, my husband has a imatinib drug, and we're not really sure about how long you should be taking it. Why? So they say it to avoid recurrence, you should start taking a drug. Sorry. Excuse me. Sorry. So how long do people take these drugs when they are given, let's say, targeted therapy drugs? How long is
I think your question is imatinib. So imatinib GIST.
Yes, for GIST. Yes, for my husband's case. Yes.
GIST generally it is given in advanced GIST, either when it is inoperable or it is metastatic. Then it is given till progression, till the time it doesn't respond to the treatment. It is given like that.
Okay. So no, he had a resection. This is mainly for recurrence. So we were just wondering. Thank you so much. It was very helpful, and thanks for the good talk.
Welcome. Hope it was useful to you.
Sure.
Good afternoon, Dr. Sriram here. I just wanted to know how prevalent is integrative therapy in India for cancer, because what we hear is recent findings as diet plays a significant role in managing and even preventing and healing cancer. So how prevalent is integrative treatment, including naturotherapy, for example, along with the conventional or alternative medicines?
I think it happens in institutes. In clinical practice, I don't see interaction between natural therapy and modern medicine which we practice, because each one is not aware of the other's experience. If you take my particular instance, I wouldn't have much idea about natural cures for cancer, and those who deal with natural cures may not be much aware of surgery, for instance. So to answer your questions, no, I don't think it is very common to have modern medicine and natural cures interacting with each other much. Yes, that's something which we need to work at.
Good afternoon, doctor.
Good afternoon.
Just I want to know about the symptoms of cancer.
There are 7 important things which we look for. Cough, persistent cough, especially in a person who is a smoker, which is not responding to treatment. Ulcer or wound, ಗಾಯ ಏನು ಇದ್ರೆ ಅದು heal ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಅದು ಕ್ಯಾನ್ಸರ್ ಇರಬಹುದು. Then lump or tumor, any part of the body, maybe in the breast, anywhere. Excessive bleeding, like from uterus or something like that. This could be cancer. So these are some of the common findings which is given to the lay public for to see if they have a suspicion of cancer. So any doubt is there, if any of these things are there, it's better to consult a oncologist and find out if the person has cancer or not. So most important is quick diagnosis. Certain cancers can be diagnosed easily. Certain cancers it may need several tests to find out.
Good morning, doctor.
Good morning.
This is Bala from Trichy. How to improve our immunity apart from therapy, doctor?
That's a good question. So I think by medical methods, it's not possible to improve our immunity. I strongly believe that techniques like meditation and yoga will help, especially meditation. I think it will help improve our immunity.
If we do yoga severely, someone says that cancer will not come out easily. We couldn't predict the cancer. Is it true?
No, I don't think there's anything like that. A person who has been undergone surgery for cancer or is receiving treatment for cancer, then they should take precautions before they do yoga. But as a part of lifestyle, then I don't think there's a problem. It's as a preventive method to do yoga and meditation, I don't think there is a problem. Actually, it helps. It doesn't cause any harm. It only helps in our fight against cancer. And even for those who have already completed their treatment for cancer, all this will help in keeping a positive mindset. And that helps a lot. Keeping a positive mindset, doing meditation, yoga, it helps a lot in fighting the disease.
Thank you, doctor. Thank you.
Thank you. So I have some questions in the chat box. One second, let me. Can we treat gallbladder cancer and determine it at an early stage? So gallbladder cancer is generally not possible to pick up in an early stage. There are certain risk factors for gallbladder cancer, like gallbladder polyps. If gallbladder polyps are there, there is a specific mechanism. Suppose a person has gone for some abdominal pain, and then he goes for a scan and the gallbladder polyps are found. Then there are certain factors which the doctor sees. Okay, the polyp size, number of polyps. Then he may recommend a cholecystectomy or removal of gallbladder. So this way we can pick it up early and probably prevent it also. But many times gallbladder cancer is advanced because it's picked up very late and it's not possible to treat it. But in early gallbladder cancer, which is picked up because patient has come early or because in the polyp stage it was picked up, then it's possible to cure the cancer. And next question is, does stress contribute in cancer growth? Stress definitely, I'm not sure whether it contributes to cancer growth, but definitely it helps in dealing with our problem. So patient, whether it is cancer or any other problem, stress will prevent us from effectively dealing with the problem and taking the right decisions. That way, these techniques like meditation and all that will help us deal with the stress. So that's the answer to your question. But whether stress actually causes cancer growth is not known. Is cervical cancer vaccine be administered for girls above 20 years? Yes. So the thing is, as I told you, I'll go into a little bit more detail about this human papillomavirus. Human papillomavirus is very, very common, and most women throughout the world would have got infected with the human papillomavirus once they are sexually active. Most women would have been already infected with the virus, but majority of women will clear the virus on their own. Only a proportion of people will have persistent human papillomavirus infection, and in this also, first it will be pre-cancer, then only it will become cancer. So screening is detecting this cervical cancer in a pre-cancer stage, that is screening. Vaccination, what we do is, before the woman gets exposed to the human papillomavirus, we give the vaccine. So that way it can prevent infection. But once the woman is exposed to human papillomavirus, giving the vaccine is of not much use. That's why the target age is 9 to 14 years. But at the same time, it is not that it should not be given. It can be given above the age of 20 also. But how effective it is, it will be, we do not know. If the person has not got exposed to the virus, it may be useful. But if the person has already got exposed to the virus, it may not be useful. So you can go ahead and give the vaccine, but how effective it will be, it is not possible to say. So I hope that answers your question. Irregular periods. Irregular periods. So irregular periods is a very common problem. Not all women with irregular periods will have cancer. So it's important that Pap smear is done for all women above 30, 21 to 29 every 3 years Pap smear, and above 30 to 70 Pap smear plus HPV DNA every 3 years. If we do this, then I don't think there's any problem. So it's a simple test, not very expensive, and it is very effective. So the next question. How about blood cancer? Is it with any tumor as such? Blood cancer is leukemia. So it's not a tumor. It is just an uncontrolled blood. What is blood? Blood has two parts. One is the liquid component of the and the solid component. The solid component is the cells, the white blood cells, the red blood cells. So a white blood cell, if it multiplies uncontrollably, then it's called a leukemia. The red blood cells multiplies uncontrollably. It's called a polycythemia. So these are also cancers of the cells of the blood. Which type of cancer are caused by mental stress, professional, personal life stress? Please elaborate how to prevent blood cancer particularly. Blood cancer prevention, there is no particular method of preventing blood cancer. If it runs in your families, you can just get screened whether any genetic test may be helpful to identify any abnormal gene is there. That's pretty much maximum which we can do to identify and prevent blood cancer. Angiogenesis to help, yes, angiogenesis inhibitors can help in advanced cancers. It may not be able to cure the cancer, but definitely it will help in controlling the cancer. So like bevacizumab and TKIs, they are useful in advanced cancers to reduce or control the growth of the cancers. Angiogenesis inhibitors will definitely help. You said Pap smear once in 3 years, okay. Just would like to know why 3 years? Does the test have side effects? Ovarian cancer has 3 years, good. Okay, so Pap smear is for cervical. Uterus has different parts. Uterus has the ovaries, the body of the uterus, the mouth of the uterus, and the exit passage of the uterus. The ovaries, you know, the egg producing structures. The body of the uterus is called corpus uteri. The mouth of the uterus is the cervix, and the exit passage is called the vagina. And outside, what is seen is called the vulva. So the cancer can occur in all of these parts, and different reasons occur for the different parts. Human papillomavirus is concerned only with cancer of the mouth of the uterus or the cervix, the vagina, and the external part called the vulva. It has no relation with ovarian cancer or with the body of the uterus cancer. So pap smear is only for the lowermost part of the uterus. It is only for those that cancer arising from that part of the uterus. And it is enough if we do it once in 3 years. If we do a normal pap test, it should be done in once a year. If we do pap plus DNA test, then it is enough if we do it once in 3 years. Is angiogenesis under medical treatment? Yes, it's a medical treatment. Angiogenesis inhibitors is a medical treatment, it's an injection. In some cases, it may be a tablet. There are some articles talking about plastic usage, stale food, refrigerated food. Does scientific study show that certain plastics, the chemicals which leach from the plastics, have been shown to cause cancer? I have hepatitis B virus. Should I undergo for cancer screening? It's good that you have found out to have a hepatitis B virus. You should consult a gastroenterologist or a hepatologist and take treatment for it. You have to find out the viral load. The viral load is high, you should take a treatment. There are two drugs, entecavir and tenofovir. One of these drugs, tenofovir, is cheap. If we take this drug, it reduces the risk of liver cancer by reducing the viral load. Prostate cancer, which men are risk? Any high risk features? Prostate cancer generally is a disease of old age, more than 50, and most patients will be more than 60 or 70. And benign prostatic problems are more common than cancer. Most of the patients, as they age, their prostate becomes bigger and they have difficulty in passing urine. And whenever such difficulty is there is a test called TURP, wherein the prostate is scooped off by putting a tube through the urine passage. That increases the urine flow without any difficulty. So the only way of identifying prostate cancer is by checking a PSA test. There is no other method. But there is, before it was being done routinely, but nowadays it's questioned whether we need to do it routinely because it has not been shown to reduce the risk of death from prostate cancer by identifying early.
ठीक है, जियो की तरह ना पहले सस्ता रेट रहा 300 कुछ रेट ही, प्रोफेसर हेड का 500 तो मिनिमम, दिनेश का 800 है.
Yeah, cancer does not come
दो साल बाद जो बोली
it will never come back.
जियो की तरह
पर जितना मर्जी रेट कहता कहते गोते उसी रोड ते खोलो कि ठीक है ये कुड़ी स्टेशन भी कोल है, बस स्टैंड भी नेड़े है.
There is no hard and fast rule that
रेस्ट कर ले 4 घंटे चल भी तो क्या है, एडमिट कर प्रैक्टिस कर ले बंदा 4 घंटे. 4 घंटे के अंदर लग भी गया 30 इयर्स. नॉट बैड बॉनर और अभी जजर ओडी देख ले,
the chance is less.
ना जजर
The important thing is to keep
आपका दिल लगाने के लिए मेरा
तेरा ज्यादा जरूरी है.
मैं आपके साथ याद दिल लगे
खारिज जेडी चल रही है उसे करती है, सारे खारिज कर दी नहीं तो मुझे चिंता रहेगी बड़ी.
Okay, I'll repeat it. It is not it's not uncommon for cancer to recur even after 5 years. It can, but the chance is very less. Majority of cancers recur within the first 2 or 3 years or 5 years. 5 years is just majority of decisions which you take, majority of studies, they are focused on 5 years. It is not a magic number. There is no absolute number by which we can say by this year it has not come, then it doesn't come. As the time keeps increasing, chance also keeps lessening. For example, the chance for recurrence in 1 year, 2 years, 3 years, 4 years, 5 years, if we keep calculating, as we advance in time, the chance of recurrence decreases. There is no magic number that this is that particular year after which the cancer will not recur. There is no such number. But having said that, it is important to be in regular checkup with the oncologist, take the recommended treatment which is advised, and follow a healthy lifestyle, keep a positive mind state, involve in activities like yoga, meditation to keep your tumor immunity up. There are certain things for which we have evidence, certain things which we can prove, but certain things which have been passed on from our ancestors which we cannot prove medically, but it makes good sense to follow this. I think I've answered all questions in the chat box. I hope you found the meeting useful, and I request you to please, I will share a Google form. I request you to please share your feedback on how useful the meeting was, and also what topics you would like to be discussed in the forthcoming meetings. I'm planning to do it in a regular manner to create more awareness so that you take the right treatment. So I will share a Google form. Please give your feedback and also mention what topics you would like me to discuss, which may be useful to you and for your near and dear ones.
More questions
is there. What are the stages of cancer? What do they mean? So there is an organization called the UICC, International Union Against Cancer. That is a European organization. Another is called the AJCC, American Joint Committee Against Cancer. These two organizations join together from scientists throughout the world. They sit and every 4 years or something, they come out with a manual called the staging manual. So they have given guidelines. As you know, many of the patients who are treated, we all stage cancer. They have given guidelines how to stage cancer. Based on these guidelines only, we assign a stage. So it is all written in black and white. If the tumor is here, this is stage. This tumor is here, this is the stage. Tumor is here, this is the stage. So generally, it's 4 stages: stage 1, stage 2, stage 3, stage 4. The general guideline is stage 1 is very early. Stage 2 is slightly advanced. Stage 3 is locally advanced. Stage 4 is very advanced. This is the general guidelines. But certain cancers, there are only 3 stages. For example, in testicular cancer. Certain cancers, early stages, it's good. Certain cancers, advanced stages also, it can be cured. So I don't think you should go too much into it, because it is meant, the staging is meant mainly for the clinicians to correctly document and also to compare. If there was no clear staging, then what treatment we are giving in India, we cannot compare with what treatment we are giving in US and see what better we can do. This is mostly, the staging is mostly meant for the doctors, not for the patients. Patients should not get scared seeing the stage and all that. The doctors know what stage, what treatment to give. This is meant for us to decide the proper treatment and to compare our treatment with the rest of the world and see what we can do better. This is purely for medical purposes. It is not to be taken for the general public. You should not be bothered about the stage. You just have to follow the recommended treatment. Other diseases like diabetes, hypertension contribute towards cancer. Yes, certain cancers, like diabetes, hypertension, obesity. If all these 3 are there, there is a higher risk of uterus cancer. Obesity is a risk for pancreatic cancer. So there are lifestyle also increases the risk of cancer. Obesity also increases the risk of lower esophageal cancer. So obesity, diabetes, hypertension can increase the risk of certain cancers. That's why I'm saying prevention, prevention, prevention. If only what I want to convey through this talk is, please be aware. Please be aware of the risk factors. Please be aware of the screening methods and make use of these available methods to reduce the risk of cancer. Any other questions? Okay, I think there are no other questions. I thank all of you for taking your time off on a Sunday morning and attending the meeting. And as I said, I request you again to share your views with me on how useful the talk was and what are the topics you would like to discuss in the forthcoming meetings. Thank you one and all. Have a nice Sunday. Bye. Jai Hind.